Hi, everybody. I'm Rhonda Barkus. I'm the manager for the Rural Healthcare Provider Transition Project. Thank you for joining today's webinar on the topic of community care coordination. Just as a reminder of the what the participants will be getting to learn to define community care coordination, identify the primary social drivers of health for the individuals you care for, and identify, engage, and sustain community partners to address social drivers of health. I am so pleased to have the opportunity to introduce Deb Lane. She is a colleague of ours at the center. Deb joined the center in April of 2014. As program specialist team lead, she provides education, coaching, and technical assistance to rural health networks and collaborations on topics such as strategic planning, evaluation, collaboration, community engagement, partnerships, and leadership. She utilizes her extensive background in training, facilitation, and presentation skills to assist rural health leaders to accomplish their goals. So we are honored to have you with us for this hour, Deb. Thank you for joining us, and I am going to turn that over to you.
Thank you, Rhonda. I'm really excited to be here today with all of you to talk about something that's really near and dear to my heart because of my own experiences as a caregiver of my parents, and knowing how something like our topic today, community care coordination, can benefit those that you work with, but also the whole family, really. And community care coordination is about engaging partners outside of your own healthcare organization. And so I want to talk about how to effectively identify those, how to engage them, and some things and hints about sustaining that engagement. So today we're going to start by defining what care coordination or community care coordination is. And then we'll talk about the importance of identifying the primary social drivers of health and introduce you to some tools to do that. And lastly, we're going to talk about identifying those needed partners for community care coordination and how to engage them and sustain them. Let's start with establishing some definitions so that we're all on the same page. What is health? When we're looking at health today, and when I look at health within the center and the teams that I work with, we look at it as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health has many meanings to people and to communities, and they may perceive things very differently from one community to another community or one person to another person. Health sometimes is described as a condition in which someone or something is thriving or doing well. More than a condition of individuals, however, health can also mean being in a safe, stable, and nurturing environment, and being in stable relationships, and sharing in shaping of society structure, and experiencing with our families and our communities our best possible physical and mental and social well-being. This definition can include a healthy person, a healthy community, a healthy natural environment. And with that in mind, let's align our definition of population health. And at the heart of population health, or at the heart of health, is population health. And population health looks beyond our clinical realms that we work in and that we kind of live, breathe, and swim in all the time. Here's the formal definition of population health established by the American Hospital Association. And what we're really talking about here is changing from an illness model to one of a wellness model. So when we define population health serves as a strategic platform to improve the health outcomes of a defined group of people. And it has three strategies or three stages to it. Now, that defined group of people might be a subset of your entire community. Some communities I work with are so small that it really includes the whole community. But just identifying a usable target number of people to work for. And you do that by really understanding the specific health status of your community and what outcomes are you seeing? Are you seeing a high rate of uncontrolled diabetes? Are you seeing a lot of COPD? What are some of, what do the statistics show? What are you treating in your EDs? What's walking in the door? What is the thing that's keeping the most of your patients that you're in contact with from really doing well, really taking and thriving, shall we say? And so once you've looked at those statistics and identified what we're looking at, then we start to ask, what's happening? Why is it that way? What are the factors that are contributing to that? And then for me, the most exciting part and energizing part is to say, okay, if this is the status of the people in our community, and if this is what's causing it, what can we do to intervene and make a difference in it? And that's when we start moving into that whole realm of community care coordination and pulling partners in to take and make that difference. So we have to understand that in population health, it's not just healthcare that really predicts that outcome of the patient. And this visual, I'm sure, is not new to many of you. So as healthcare providers, how do we really do population health management? And I kind of come to the state of that we do it by not solely focusing on that condition that walks in the door of our facilities, but really looking at that whole person. We need to recognize that as healthcare providers, we have control over 20% of the outcomes of an individual. And what can we do to navigate and help improve the life and lengthen the life of and quality of life of the people that we work with? How can we support that other 80%? What influence do we have in that 80%? And that's the why of population health for our communities. And so to refresh our memories about social drivers of health, these are the conditions that affect a person's health. They're the conditions and circumstances in which people are born into, grow in, live in, work in, and age in. These are the circumstances that are shaped most often by a set of forces beyond the control of an individual. They're the things like the economics that are going on in the world around them or in their community, and the distribution of money, of power, social policies, politics at the global, national, state, and local levels. This is not by any means an exhaustive list of what social drivers are, but there are things like stable and affordable housing, access to healthy foods, meeting basic needs such as childcare and transportation, having healthy homes, healthy breathing environments, healthy cooking environments, healthy environments for our children to learn in, access to healthcare, and then having employment training and job opportunities. The destination that we need to have in mind is to create a health system that links healthcare to community stakeholders, to create a network or a safety net of organizations working together to improve population health. And that's community care coordination. And that's what gets us there. It's a collaboration among healthcare professionals, clinics, hospitals, specialists, pharmacies, mental health, community services, and other resources working together to provide person-centered coordinated care. As a healthcare industry, we much more naturally look to other clinically related partners. So it's easy for us to think about reaching to a specialist or reaching maybe to a pharmacist, but it's not natural for us to look outside of our walls and look at those community services and resources that can work with us to improve our population's health, or our intended population that we're working with. There are many partners that we can collaborate with, refer to, and lean on. Some you may already have relationships with. Some you can see from your building. Others are out of town, and some are even out in the region. But together they weave a safety net for your patients. This is the concept of care coordination. And when we extend it beyond our walls, it becomes community care coordination. Your organization can seek services from partners to meet the needs of your patients that really aren't your expertise. Your hospital or clinic is the connector of these services. And because you are the connector, you receive the credit for such, building customer loyalty for a comprehensive solution. The patient's outcomes can be maximized, and they feel a sense of community support and continuity for their well-being and care. I want to dive a little bit deeper into community care coordination. And I'd like to review some of the benefits of reaching outside the clinical realm. I think you'll see the benefits for both your organization and those patients that you're working with. There's better coordination of services and care provided to the community. Now, remember that slide that showed 20% of a person's health is attributed to their clinical care? In light of that, in order to affect that other 80% of the person's health, we need to coordinate care with those partners. If you remember, community care coordination is all about collaboration between clinical entities and community services to provide that person-centered care. Greater collaboration and better communication amongst leaders and providers. As providers strive to see better outcomes for their patients, there's a greater need to collaborate outside the clinic walls. Intentional community care coordination brings community leaders and providers together, thus bettering the communication and strengthening collaboration, all with our patients in mind. Increased promotion of local healthcare and social services is a benefit of community care coordination. A way to describe this is like a two-sided coin, where healthcare providers are working with a patient and connecting them to needed services in the community. So those community services are being promoted. But then when those community services, looking at the flip side of the coin, are working with the person and are encouraging them to circle back with their primary care provider and promoting healthcare services, they're promoting and they're benefiting you. So it's really this two-sided coin. And community care coordination is really all about promoting the right care, the right service at the right time in the right place for that particular person, which isn't any new news for most of you. Enhanced marketing to better promote your services and your quality of care is another benefit. In community care coordination, it's no longer the healthcare organization all by themselves. The other healthcare professionals, clinics, hospitals, specialists, pharmacies, mental health providers, community services, and those other resources in the community are promoting your services and your quality of care. The whole community, in a sense, is promoting what you as a healthcare organization does. There's greater community awareness of available resources and services. When you're doing community care coordination, a natural benefit of the collaboration effort means that there is simply a greater awareness of the services that your organization offers, but also what is available in the community from other organizations. And so this greater awareness really can be a win-win for community members, for healthcare organizations, as well as all of those organizations serving the community. Improve community perception of local businesses, hospitals, and clinics. The focus on all organizations participating in community care coordination is really improved health for the community members. That's the central common focus. When the community begins to understand this, there will be improved perception of the businesses that are involved, the other organizations that are involved, and your local healthcare organization. Because you really do care about them, and they start to really perceive that because of all of this connection and support going on. Something we often don't think about is the bypass. The persons that are just passing your organization by to go to a larger tertiary center, for example. And so community care coordination is really about reducing the bypassing of local organizations as well as your healthcare organization. As a community begins to understand what services are really offered locally, they're much more likely to stay there and reduces that bypassing, that out migration, which does cost our healthcare organizations a lot of dollars. And so community care coordination really can help reduce that bypassing. Increased patient loyalty and employee satisfaction. In community care coordination, patients see their needs being met by your organization, even if it's actually being met by another organization, but you referred them to them. And the organizations you refer to really become an extension of your healthcare organization, all increasing loyalty of your patients. But employees are seeing things being addressed through community care coordination that may have been overlooked for years because there just hasn't been a mechanism to address those things. And so when they see these things addressed, employee satisfaction increases as they don't feel like they're beating their head against the wall. There's increased alignment of local services to community needs. When you embrace community care coordination, the collaboration of working together, you identify the gaps in services and work together at addressing those particular needs and figure out how to work together to meet those needs. Community care coordination improves reimbursement. So there's local revenue and earnings and jobs for greater economic growth. Community care coordination will affect the bottom line of your organization in multiple ways, and other organizations that you collaborate, their bottom line is affected as well. Some very common mechanisms right now for reimbursement is for chronic care management, or what we call CCM, and then also TCM, which is transitional care management. Both of these are for the Medicare population. And community care coordination is really a key in making those successful and really reducing the likelihood of some of those patients having to come back to the hospital, come back to the clinic more often, or appear in the emergency department. New local services may be developed affecting the local economy because of the work that you're doing. And another big piece mentioned in a previous slide is that piece of bypassing or that out migration. By having that reduced, you in your healthcare organization will be able to retain and get that kind of income. All of this has an effect on your local economy and has a lot of opportunities for economic growth. There's greater benefits from value-based care programs and better position for population health. Community care coordination is the linchpin of value-based payments. And remember the value-based payment formula that focuses on quality and on cost. And community care coordination does just that. Community care coordination addresses that whole person. So there's a detailed look on the benefits of community care coordination. So community care coordination is really all about partnerships. When we talk about the things in detail or detail the benefits, those partners are mentioned all the time. And when we look at that as healthcare organizations, we only really can affect 20% of that person's health. We need to reach out and establish partnerships. But who do we establish those partnerships with? Partnerships may be individuals with lived experience with a particular social driver of health, or they may be organizations that provide services for those social drivers of health, or it could be community influencers. No matter how we look at it, social drivers of health really are at the root of who we use as partners. So how do we know who these partners are? How do we name them? Well, by understanding the needs of the population that you're targeting. To identify the social drivers of health, you use your own feelings and your own experiences because you know what your patients struggle with. You also use the voice of your community, either through focus groups or using a report like your most recent community health needs assessment. And also taking a very hard look at your community's secondary data and use that secondary data to validate those social drivers that you're thinking about or seeing. First, we'll focus on determining those social drivers of health. A reminder that these are the things that get in the way of your patients achieving their goals. That these are things often beyond their control. When looking at social drivers of health, let's start with what you know in your heart, in your gut, what those patients struggle with. And then one of the main places to hear the voice of your community is found in that community health needs assessment. This is a systematic process of involving the community to identify and analyze community health needs and assets in order to prioritize these needs and ultimately develop a plan and act upon those unmet needs of health in your community. A community health needs assessment and implementation strategies are required of tax-exempt hospitals as a result of the Patient Protection and Affordable Care Act. It's a requirement for every critical access hospital that this be done every 3 years. If your assessment is 2 years older, looking at new secondary data is really important because of how fast things begin to change. And that secondary data, I find it really fun and interesting to look at a community's data. Looking at that data from many sources always brings reactions from me like, oh, that's really interesting, or that's why that's happening. And then sometimes I'll see a statistic and wonder, what effect will that have on our community? Using secondary data to back up your observations is really important. We know what we're seeing, and so we have that gut check. And then we see what is in our community health needs assessments and what we're hearing from our community. But data is really important. And some of those places to be looking for secondary data are county health rankings. Our website, ruralcenter.org, has some wonderful data on it. We can use census data. And I found in my work with multiple states that either the State Office of Rural Health or sometimes your state's public health department have depositories of data, and they can be accessed. So the landing pages are on this particular slide. So when you receive a copy of this presentation, those links will be included and you will be able to click on them and go right to health rankings, our website, and in getting into some of that census data if you already don't have those links. You'll also, with the recording, be able to access some of the tools that we've been using for 4 or 5 years with numerous healthcare organizations with a lot of success. And I kind of just put these into a discovery area. These are tools to help you discover what some of your social drivers are for your intended population. The first one is a place for you to be recording your thoughts on what those social drivers of health are for your intended population. What we went over previously, it's what does your lived experience say? What are you seeing? What are you feeling are those social drivers for the patients that you work with and the barriers of them achieving the health outcomes that they want to achieve or you would like to see them achieve. And then what are you seeing and observing from your community health needs assessment and any other voice from the community? And then finally, a space for you to be recording what you're seeing when you look at your secondary data. And this is a way to start to compile a list of all of those social drivers of health. This is really an important step in the process of developing community care coordination. It's one to take very seriously. And you may wish to dive below the waterline, as I say. Just like an iceberg, we only see a little bit above the water, and there's a lot that we don't see. It's unseen. And this discovery tool will help you find that below the waterline, if you will, or what some of those deeper social drivers of health may be. And to do this, in the beige column, you would write your primary social drivers of health that you identified, and then ask yourself, but why? But why? And ask yourself, but why, twice, and you're going to get much deeper into the real root of what is causing some of our health issues, really getting into deep social drivers. Knowing your primary social drivers of health is key. If one of the social drivers of health is food insecurity, consider bringing partners such as grocery stores, community gardens, farmers markets, school meal programs, food pantries, SNAP, WIC. Those are all some real natural partners to be bringing to the table. If it's housing, you might want to include emergency shelters, assisted livings, long-term care, along with housing authorities or transitional living. These are just a few examples. By completing the potential partners discovery tool, you can identify those community entities that address various social drivers of health. Again, you will be getting this link, and this is just really a helpful starter tool to dive into identifying those social social drivers of health, and mentioning the different partners, but it's a good tool for you to access and use as well. And this tool, the potential partners, to figure out, okay, now we know that these are our social drivers. And if we've done that, but why, or that below the waterline, we've got some of those really deep social drivers of health. You would list them in the far left column. And then the two columns on the right are an area for you to start writing in who impacts those social drivers of health in your community. What organizations, what persons have an impact on them? And to begin finding some of these, you may have a community resource directory, which could be housed in different agencies and different communities. And perhaps your organization has one in your EHR. Other places, the county public health departments have them, and in some communities, they can be found in nonprofit organizations within the community. Also, your personal experience will tell you places for solutions. If you live in the community that you work in, you're just naturally going to know some persons as well as organizations that can help alleviate some of those social drivers of health. And I'm sure some of you have many other places that you found this within the community. And then when you're starting to look at those organizations that are listed in the two right-hand columns, or in the white, those that you see listed more than once are ones to really start partnering with first as you begin your community care coordination efforts and begin to take and expand from there. When considering partners, we must keep health equity in the forefront of our minds. I like the Robert Wood Johnson's definition, and we often use that at the center of health equity, which health equity means that everyone has fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, a quality education and housing, safe environments, and healthcare. So who can help with access? Who can help with participation? Who can help with representation? And who can help with outcomes? We should make sure we're thinking of groups of people that have been historically underrepresented so they don't get left out of your care coordination program. So let's change gears here for a moment. We've talked about what community care coordination is, and we've talked about identifying the social drivers of health and what organizations or individuals affect those social drivers of health for your intended population. Now I want to start talking about how you bring those partners in and how you engage them, and some ideas of keeping the momentum moving forward. This partner message worksheet is a place that the time invested in doing it is well worth it. So often I'll use this in a workshop I'm doing, and organizations will say, do we really have to? And then when I have them talk about their community care coordination, how they brought partners on board, they'll say over and over again that at first we didn't know about this, but this is the most valuable tool that we have in our pocket to be using, and really encouraging persons adventuring into developing partnerships to spend time doing this, because you record the organization down on that left-hand column, And then you start to identify a person or a position that would be the key person to be working with your community care coordination efforts. And then what their role or their contribution would be to your effort. Is it education? Is it providing some food security or some food ideas? Is it providing good meals? Is it providing education on cooking? And then really putting yourself into their shoes and saying, what is in it for them? And the final 3 columns are about focusing on issuing the invitation and figuring out what that message might be, who's going to deliver it, and what the method of communication is. This is a detailed partner conversation worksheet. So when you're getting ready to talk with a partner, this is something that's there to help you. And again, these will all be attached to the recording, so you'll be able to access them. You'll need to do an individual one like this for each person that you're going to be asking to be part of your effort. This will take time, but upfront, the time is really worth it. These questions will help you determine what's in it for them and help you develop a formal message. To prepare for this conversation, these questions will be really helpful to think through. Things that will help you be comfortable talking with them, because a conversation needs to happen to build that new relationship. And I'm a person that needs to be prepared. And so something like this is just really helpful for an individual like me. The invitation is more than just time, date, and place. Will you come to our meeting on such and such a date at 2 o'clock at the hospital? To be more effective, it really needs to be tailored to each person that's being invited to the partnership. We need to think through the question, what is the invitation that we can make for people to participate in really creating a future that is distinct from the past? What are we trying to do together? Are we trying to reduce the number of persons that come into our emergency department because of an asthma attack or because of uncontrolled diabetes? The invitation is also a call to action. It's a call to create that new future together, to join in creating new possibilities. And so when we look at inviting somebody from these 2 perspectives, we're issuing an invitation with confidence. We are being very explicit about asking for them to join us. We're all busy. We need to know exactly what's expected of us and how we can work together to really make a change about something we care about. The invitation is about making that concrete connection between the partner and what your community care coordination efforts are for your healthcare organization. Again, it needs to be explicit, not implicit. You need to ask and talk about what you want to create with them. And this can be done by using that form that I talked about. And the caution here is that it does take time and energy up front, but it can save a lot of time and energy down the road. Your organization and other organizations are making an investment in this partnership, a partnership that will make a difference for the people you serve as well as for your organization. And you don't want this investment to lose forward momentum. And keeping the momentum going may seem like an odd thing to talk about before a partnership is formed, But this gives you a rare opportunity to really be intentional about keeping that forward movement with your partnership. So I'd like to offer a few key ideas in keeping momentum going for a newly formed partnership. These first two ideas come from what I call Deb's book of experience. And the number one thing is you've spent a lot of time being intentional about who you should involve in your care coordination efforts. So engaging the right people at the very beginning is so important, because this is what leads to ownership. We often talk about buy-in, and buy-in is asking somebody to participate in something that they didn't have the opportunity to vision in and to be in at the beginning. But if they're in right at the very beginning, they're going to buy into it, be more participative, just a whole different experience. It's not like pushing a boulder up a hill. It's them coming along with you as you're developing your program and working, creating that new future for your intended population. Community care coordination, it's a lot of work. But when others have some responsibilities, not only does it equal ownership, but it lightens your load. And so when there are some things that other organizations can do, allowing them to take the responsibility for it and do it. And the risk that we always have to think about here is that by giving responsibility to others to keep the momentum going, it may not be done the way that you would choose to do it, but there's more than one right way to do most everything. And so it relieves stress on you, and it really creates that ownership. And that's what keeps momentum going. Remember to celebrate your accomplishments, big steps, small steps, across your organization, across organizations, within the communities, within senior leaders, and just letting everybody know the good work that you're doing. And then take time to build community. That creates forward momentum. And it can be done by just simply small ways. Every time you get together, let everybody talk about something personal that's going on, whether it's what's a good thing that's happened in this last week, or what's your favorite flavor of ice cream, or your favorite cookie. I mean, it's just building those relationships really creates community, which creates sustained momentum. Setting goals so you can see progress, and that helps, celebrate the things that you're doing. But having goals or outcomes, you know about that as a healthcare organization. You have goals that you want to meet. You have quality measures you want to meet. They act as a beacon to aim toward. And this is so important, because then you can start to see movement as you progress on your community care coordination program. Secure meeting dates early. If you're going to meet regularly, set them up ahead of time so that everybody has them on their calendar. Make it a habit to have everybody bring their calendar so you can set the next date. This just really creates a culture of wanting to be inclusive, involve people, and easily continue that forward movement. And continuous planning. Intentional planning goes a long way in sustaining these community partnerships. Pulling together for informal planning or formal planning, community members or your partners feel heard. And you can figure out what's going well, what's not going well. You can make the changes, you can pivot where you need to. And with things happening so fast in our healthcare environment, we used to say every 5 years you need to do intentional planning, but I really feel like doing a major planning effort every 3 years at least, and annually looking back at what's gone really well and what changes do we need to make in our community care coordination efforts in order to continue to meet the needs, and doing any retooling that we need to do. So we started out by defining community care coordination, and it's about reaching outside the walls to those other entities that affect that 80% of a person's health, and completing a team to come around a person to make an impact on their health. And by identifying the social drivers of health, using the tools provided, you'll know who to invite to the table for community care coordination. And we also talked about engaging those partners and gave you some tools for doing that, and talked about some hints for taking and sustaining those efforts. And I'd like to open it up for questions right now.
Oh, Deb, there is a question in the chat box. Maria Mendez asks, how do we properly refer patients? We have a high awareness of community organizations, but struggle with the referrals specifically to social drivers of health versus medical referrals.
I want to jump in too, because Tim responded to that. So I wanted to share that. And then Deb, maybe you have some other thoughts, and other people might have thoughts about what's been successful around referring to social drivers of health referrals. So Tim, thank you for putting your thoughts in. I'm at the American Heart Association, and we've seen a lot of clinical partners help start and engage in networks through tools like Unite Us or Find Health. Both are closed loop referral systems designed to link clinical and social resources to individuals who need them. So that was one example that was suggested.
Mm-hmm.
Other thoughts that you might have, Deb?
A piece as a healthcare organization, you really need to have your own internal care coordination process down. So you know what the referrals are within your system and how a patient works through your system. And when we get to the patient's goals and who that care team is going to be, that's the piece that we need to start looking outside the box. It's not only going to be the care coordination manager, that person that calls the person up and say, you know, do you have your medication? Do you have any questions about it? That's where we start to identify those organizations outside of the community. And if you're not doing community care coordination right now, this is such a perfect opportunity. And I talked about pulling people in from the very beginning. Coming here today, I was thinking about some examples. And one example that came to mind is a community that I'm working with that has a high degree of uncontrolled diabetics, particularly in their Hispanic population. And so they looked at, they have their flow down within their healthcare organization. But how do we get that SNAP ed person involved? How do we get the nutrition educator involved? How do we get all of these, the wellness director involved? How do we get the employers involved? And so by taking and pulling those people together to say, we know for our community's health, we need to do this. We need to work together to take and bring the A1Cs down, bring, you know, make sure that they are in better control, because it's going to benefit the employer. It's going to bring people into the wellness center. And by pulling everybody together and doing some planning together, and part of that workflow and that referral process is part of that planning. So if you have someone that they just don't have a place to walk and exercise when they're trying to work at getting that diabetes under control, and the fitness center does. And so how do we work with getting that person to the fitness center. We need transportation, and pulling those kinds of things in and having that flow directly out to them. In that particular community, they use their EHR to take and record those things. And some community partners have certain access to that EHR, so they can circle back around and say, we talked to this particular person, and they're going to be coming in next week to start walking our track, or coming in for a matter of balance class or whatever it may be. So pulling that group of people together to do some planning of how can we as a healthcare organization refer to you, how can we close that loop, that closed loop piece that you were talking about, Rhonda, or reading that response for, because that closed loop, the provider knowing or the nurse knowing that has happened.
And we have another question. I'll go to Marquita in just a minute, but it sounds like then, Deb, kind of thinking about the social driver of health, those kinds of referrals, very similar to the medical referrals, where all your resources up front, you have everything ready so you can share the right information with somebody and to be able to say, hey, I have a resource here. I'd like to refer you to this. This is okay. And then this is all the information you need, instead of just saying, hey, here's a card, go call this person. And
exactly
possibly
right.
even doing a warm handoff whenever possible as well, and clearing the path for that person.
Yep.
So, okay. All right, Marquita, I know that you have your hand up if you'd like to unmute.
Sure. Thank you so much. I thank you for the time. So, hi, my name is Marquita. I'm actually at Northwestern University. And I say with pride, I am in the third largest city in the nation and proudly do rural health research. And so I mentioned that because throughout the work that you were talking about, Deborah, you mentioned partners to reach out to, and you've mentioned all of these scales, and you even mentioned addressing secondary data analysis. However, there wasn't any mention as far as academic partners. And I actually focus on community coordination, care coordination through community health workers and rural lung cancer survivors. So I think there's a reason why we weren't on there, because we're not historically in these areas. And so I'm very curious on ways in which we can build build onto that partnership circle that you have. And what are ways in which academics and researchers who focus on community engaged research can be intentional about building relationships with organizations like yourself or organizations that are also represented on the call today?
I guess one of the first things that comes to mind is reaching out as an academic organization. I mean, you are totally right. With the kind of research that you're doing, if you're working with community health workers are one of the best ways to close the loop, because they have their foot in both the medical world as well as in the community world, and also in the life of the persons that you're working with. And as I'm thinking about some of the communities I work with, they do reach out to the academic world, whether one community, there's a 2-year college that deals with hydroponics. I mean, that's their focus, and food insecurity is huge. And so they work with the research that's being done at that institution in order to provide food for some of their people that are food insecure, but also teaching others how to take in and provide more food for them. And that's just one really specific example. But, I need to take and add that into my presentation and my talking. Because as I'm sitting here thinking about it, there are lots of things that academia can do or to support. And one of the biggest things is all of us that are in healthcare organizations to remember that, to reach out to that, but then also as working in the academic field, reaching out to your local healthcare organizations to say, this is the resources that we have or how we can take and help, because community care coordination is all about connecting things that normally don't work together and making those bridges. And so thank you for bringing that up. And I just think it's a great resource, and we all have to take responsibility for reaching out and not forgetting to reach out.
And while Faith is finishing doing the other polling questions, Deb, I was thinking about a CHNA I did one time, and there was somebody from academia, and they actually had a lot of students who were underserved populations. And so the college specifically reached out to the hospital and all of those other organizations and kind of forge those relationships. And I was thinking about the resource that you provided too, where you think about, okay, what's in it for them? What's the message I'm going to craft? Who's going to give it? So even using those same kind of things.
Yep. Those tools are usable in so many different situations, not only community care coordination, but also just finding community joint partners to make things happen in your community.
Yep. Well, Deb, I want to thank you so much. I know we're at the top of the hour. So thank you for all of that information. Very, very complete and thorough. I really appreciate the work that you did to pull this together. As Faith is finishing up the polling questions, just a reminder that today's webinar is recorded. The slides are going to be available on our Help Webinar Playback page within about 5 business days. Also, if you are interested in getting ACHE credits, please make sure that you fill out the short online assessments from this webinar, and Faith will put that link in the chat box, as well as send an email to everybody who participated today. And if you have any questions about RHPT or the project and what we do around preparing hospitals and clinics for value-based care, you can reach out to us at RHPTP